Welcome to another episode of Clear Lake Connections, where we talk to the people behind the businesses of Bay Area Houston, proudly sponsored by UTMB Health. Today's special guest, you are Dr. Danielle O'Connell, and you are with UTMB.
That's right.
The urgent care side of the house, or the ER side?
The ER side.
ER side.
Yep. So I actually have a bit of a hybrid job. I'm half ER on faculty in Galveston, and then half ICU in the community hospitals.
Okay.
But, yeah, do a little
But
of both.
Today we wanted to talk about an important topic of when to go to urgent care versus when to go to the ER. And so let's dive right in. Describe the main differences between the ER and the urgent care.
The main differences are mostly acuity. Whenever I think of when to tell somebody to go to the ER, I think, is this illness or is this reason that you're seeking medical care a danger to your life or your limbs? So is this something that could eventually lead to death or loss of function of one of your limbs, like one of your extremities, your legs, your arms, whatever? Whereas, urgent care is a little bit less acute. So it's more like cold, flu, mild dehydration. If you have a broken bone in your hand or your foot, they can handle things like that. So it's mostly the acuity.
And there's been a big proliferation of urgent care clinics, right?
They are everywhere.
Yeah.
They are everywhere. UTMB actually has 6 in the surrounding areas.
And what do you think's led to that?
I think that they try to open up these urgent cares to kind of offload the ER a bit. ER volumes just consistently are increased every year. I think the UTMB ER volume for the year is up 12% from last year and then 10% from the year before that. So it just continues to rise. So the opening up these urgent cares kind of helps free up those beds.
Yeah, and I'm a big fan of the urgent care clinics because you can get in same day.
Yeah.
If you call most doctors these days, it's, we can get you in next month. I'm like, well, that's... So talk about the model and how that works.
So UTMB specifically actually has, you can make appointments at the urgent care. So if you go online, do a quick Google search of the UTMB urgent cares, you can set a time that you're going to go, which I think is super helpful. Emergency room wait times are pretty unpredictable. Weekends and afternoons, you can be in the waiting room for hours, whereas the urgent care tends to move a little bit faster.
Yeah, and talk about the cost, because really that's one of the reasons I've always read that makes medicine so much more expensive than it used to be, is just people going to the ER instead of the urgent care.
Yeah. So urgent care is almost like way less expensive than the ER visit. It can be a couple $100s out of pocket without insurance, whereas emergency room visits are more in the thousands. And that's just basically use of resources.
Yeah. And so if you go with something mild, or like you said, it's not acute, you're looking at not only spending more money for the same ailment, but also an incredible wait probably.
Right, exactly.
Yeah, I went to the ER once, and I had chest pains, and I found out that's the fastest way to get seen in
It
an
really
ER.
is. It really is. Some people learn that and kind of abuse the system in that way, but it really is. So if you say you have chest pain, you're coming right back to see
So
us.
speaking of that, when should you call an ambulance to get to the ER, and when do you think it's okay to have either a loved one or yourself go to the ER?
I think if you need an intervention right that second, it would be worth it to call an ambulance, because EMS crews are able to do basic interventions. And, if you think that you may be having a heart attack, I think it'd be appropriate to call an ambulance so they can do an EKG and see if you actually are having a heart attack. If you don't need intervention right away, say you fell and you think you broke your arm, you don't necessarily need an ambulance to take you. That's something that you could go by private car. People are now using Ubers actually to go to the ER just because it's less expensive than an ambulance. But your Uber driver is not going to give you any help.
Right. Yeah. Lack of training there.
Right. A little bit.
So tell me more about what your role is with the ER and the faculty side.
So I'm a pretty recent hire for UTMB. We just opened up a residency program. So we train residents right out of medical school for the specialty of emergency medicine. And so I'm one of the faculty that works with the residents. We do a lot of teaching. Once a week we have conference. And we're trying to build the residency to be as big as it possibly can be within UTMB.
So how recent? did you start there?
I joined 6 months ago.
Okay. And how's the experience been?
I've absolutely loved UTMB.
Yeah, we almost everybody we interview, just the culture at UTMB is sounds amazing.
It
and
really is.
People love it.
A huge reason I wanted to come here, I would tell people like, oh, I'm going to interview for a job at UTMB. And they would say, like my nursing friends would say, I've always wanted to work there, but there's never any job openings because nobody ever wants to leave.
So that really does speak to the culture.
It really does.
So back to the ER. Do you also work in the ER?
I do. So I do half clinical shifts in the ER and half my clinical shifts in the ICU. But a few days a month, I am the Galveston ER.
So tell me the difference between the ER and the ICU and kind of, how you end up in either one.
So the ER is where you go immediately after you have an emergency or as you're having an emergency. ER physicians stabilize that emergency and then likely will send you to an ICU if you're very sick. The ICU side of things, they get to kind of explore why you're having that medical emergency and continue to take care of you until you're through your emergency. So the ER side is more stabilization, ICU is more longer care.
And so what got you into wanting to become an ER doctor?
I considered dermatology for a while, and I shadowed in a dermatology clinic, and it was not very exciting.
Not all it was cracked up to be.
It really wasn't. So I was like, I need the action.
Okay.
So I love the ER. I love the procedures that we do. I love having to, think on my feet and kind of take charge in emergent situations.
Yeah, and I've heard other ER doctors talk about how they get to take care of business, and then they get to move,
exactly
push the patient onto somebody else for longer care.
Exactly. You stabilize and you move them out.
Okay.
And it's also nice because it's shift work. So you finish your shift and then you go home, and you don't have to worry about patients calling you and things like that.
Yeah, we've heard that from several people.
Yeah.
So I've heard people go to an urgent care and some of the services that they need aren't available. Talk about the difference in the services that you get referred to an ER from an urgent care, for example.
Sure, yeah. So urgent cares don't always have advanced imaging. So, they can do basic x-rays, but if you need something like a CAT scan, like if you're in a major trauma or something like that, or, you need invasive procedures, like you need to see a cardiologist right away, they would refer you to the ER to be seen because they don't have MRI, they don't have CAT scan, they don't have ultrasound machines, things like that, but the ER does.
And you said you have 6 locations in the area. Where exactly are those urgent cares?
The urgent cares are, they're at Galveston, League City, Texas City, Alvin, there's 2 more, Danbury, and Clear Lake.
Okay. So, but it's ever growing, it seems.
It really is, yeah. So we have 4 emergency rooms and then those 6 urgent cares.
Okay. And are the urgent cares kind of surrounding the ER areas?
They are.
Okay.
Yep. And if the urgent care can't handle that emergency, then they end up getting transferred to an ER.
And where can they find them? So go online, UTMB, and search for the urgent care clinics?
Yep. And you can actually make appointments online.
Okay. So let's dive into more of the symptoms that would lead one to go to pick urgent care or ER. So, for example, heart attack, stroke. What are the symptoms that if you have that would help guide your choice?
That's a really good question. So if you're having chest pain, especially chest pain that radiates down your arm, you're sweaty, you feel short of breath with this chest pain, that could easily be a heart attack. I would go to the ER. Or if you're having weakness on one side, difficulty with saying words that are coming to your brain but you can't quite get them out, that could be symptoms of a stroke. So that's something that needs to be seen in the ER.
And then urgent care, I guess it would just be sniffling, sneezing, that type of thing.
Cold and flu, and then minor sports injuries if you think you maybe sprained your ankle. But if your bone is popping out, I think that should be the ER.
Yeah, definitely. So anytime there's, I guess a good indicator in deciding would be the amount of blood.
Right, right. If you're losing a lot of blood, definitely go to the ER.
Yeah, so tell me more about this residency program, because it seems like everything at UTMB is expanding, growing, and this is just another example.
It is, yeah. So a lot of the major academic hospitals have an emergency medicine residency program. We are just starting ours up, and we've already made waves within UTMB. All of the consulting services that exist there, like neurosurgery, orthopedics, they're all very excited to see that we have residents, and they're all very willing to teach these residents how to be good doctors. They're very accepting of our residency program.
Yeah, and I don't think people realize when they go to the UTMB that they're going to learn from, or they're going to be seen by not only doctors, but in almost all cases, residents.
Yep, that's true. So residents are really probably the first ones that see them. And of course, in really severe cases, there's an attending, which is what I would be considered there with the resident. So the patient's going to be taken care of by a resident physician and an attending physician.
And so how did you find out or find UTMB?
I came from Houston. I, just went to Galveston one day to go to the beach, and I was like, hey, UTMB would be a great place to work. That's a great hospital system. It's the oldest medical school. I knew I wanted to do teaching, so I reached out to the chairman of the Department of Emergency Medicine and kind of told him what I wanted to do for my job, and he made it happen.
Okay, so it was just you just went for it, and
I went for it. I knew I wanted to be local, and I knew that UTMB was a very respectable institution to work for.
So the beach kind of led you there, huh?
It sure did. It sure did.
So how'd you get into med school, becoming a doctor? What led you there?
I really liked science, and I went to Baylor for undergrad. They had a really good pre-med track, and so that's kind of what I found myself doing when I went to college. I applied and went to med school right away in San Antonio, so University of Texas in San Antonio, and then I did my residency training and my fellowship training in Houston at University of Texas.
Can't get away from the UT thing, huh?
Can't at all.
So ER runs the full gamut. Do you have anything specifically for pediatrics? We
do, yeah. Actually, the Clear Lake Hospital has a pediatric emergency department. It's 24/7. The staffing there is specifically pediatric trained emergency physicians. They're very good. If your kid needs extra oxygen or anything like that, it's RSV season. We're seeing a lot of that. If they need oxygen, they're having trouble breathing, that's the place to go.
Yeah, and so it is cold and flu season, and obviously COVID. So would you prefer those people go to your urgent care or your ER, I guess, depending on the severity?
It really depends on the severity. If it's mild cold and flu, that can be seen at an urgent care. They may give you an inhaler, maybe a steroid pack or antibiotics if necessary. But if you're needing oxygen, if you're really having trouble getting words out, if you can't complete a full sentence without stopping for an extra breath, you may be needing oxygen. So that's something that you should be seen in the ER for.
Well, thank you for being on the show.
Of course. Thank you guys for having me.